Welcome to today's Explainer. We're diving straight into the complex and, honestly, often misunderstood world of substance use. We're going to unpack exactly what these substances do to our bodies, how modern technology is stepping up to help us track our habits, and most importantly, we'll map out the help that's out there for finding a true pathway to recovery. So whether you're looking for information for yourself, maybe a loved one, or you're just a focused learner wanting to understand the real mechanics of addiction, you are absolutely in the right place. Let's get into it.
But hey, before we get into the heavy data, I want you to ask yourself something. It's a pretty powerful question. How much control do you really have over your daily habits? Seriously, think about it. The answer might actually surprise you once we look at the underlying biology of human behavior. We often think of our routines as purely conscious choices. But as the source material reveals, there are deep biological imperatives at play when it comes to the things we consume.
Section 1. The impact of substances. Okay, let's establish a baseline here. When we talk about recreational drugs, and that includes everything from alcohol and tobacco to cannabis, cocaine, and prescription misuse, we're talking about substances people specifically seek out for pleasure. But that pursuit of pleasure, it comes with some incredibly steep risks. These substances can severely damage bodily systems, causing everything from respiratory issues to liver damage and serious cardiovascular problems. They impair our judgment, which leads to risky behaviors, and they can ultimately result in fatal overdoses. It's a stark reminder that what starts as just a recreational choice can escalate incredibly fast into physical and psychological dependence.
Let's actually compare the biological impacts of two incredibly common substances, alcohol and cigarettes. Alcohol is the most widely consumed psychoactive substance in Australia. Its active component, ethanol, acts as a depressant. It essentially acts like a massive roadblock, fundamentally disrupting neural communication, interfering with the connective tissue at the ends of your neurons, and actually shrinking your frontal lobes. Now compare that to smoking. When you inhale cigarette smoke, carbon monoxide literally supplants the oxygen in your red blood cells. Your body panics over this lack of oxygen, makes more red blood cells, and dangerously thickens your blood. Those oxidizing chemicals then damage your blood vessels, leading to atherosclerosis, which is the buildup of fatty material on your artery walls, and that drastically spikes your risk of heart attack and stroke.
Section 2. The addiction spectrum. This next concept is a real game changer, honestly, because it completely strips away the stigma we usually associate with substance use. It suggests that whether we're talking about technology, food, relationships, or recreational drugs, we are all biologically wired to find solutions for what is missing in our lives. We all exist on this spectrum. That inherent biological imperative to fill a void, it's a universal human experience. It really connects us all to this topic.
So, the real crux of the issue is this. The pursuit of pleasure isn't necessarily the problem itself. The condition of addiction arises when we lack the proper coping mechanisms to address our underlying challenges. When that biological need gets completely overwhelming and we just don't have healthy ways to process our stress or our trauma, we seek external solutions. That's when a simple habit crosses the line and becomes totally self-destructive.
Take a second and really think about your own daily routines. Where do you land on this spectrum? What do you reach for when you're stressed out, exhausted, or just feeling empty? Is it a glass of wine? A cigarette? Is it endlessly scrolling on your phone? Simply building awareness of your own coping mechanisms is the absolute first and most vital step toward making a change.
Section 3. Tracking your habits.
Now, if we want to build that awareness, we have to actually measure our actions. And the tech available today for personal tracking is mind-blowing. For alcohol, we've got personal breathalyzers like BAC Track and Alcohawk that sync right to your smartphone to track your blood alcohol content. For smoking, portable carbon monoxide monitors can measure CO levels in the air to indicate recent smoking. But get this, perhaps the coolest innovation is the smart lighter, like the Plasmatic X. These are rechargeable electronic lighters that actually track your ignition frequency. Imagine being a smoker and having a device that physically forces you to confront exactly how many times you've lit up that day. That kind of real-time data is incredibly powerful for breaking a habitual loop.
But it's not just about us as individuals. Zooming out, public health officials conduct massive population surveillance using these specific behavioral data points. They're tracking how often people use, binge drinking patterns, the age people first try a substance, and polydrug use, which is using multiple substances at the same time. Gathering this data is absolutely critical. It's how officials spot major public health trends, like the encouraging decline in smoking rates across a lot of developed countries, or, on the flip side, the deeply concerning rise of the opioid crisis.
Section 4. Pathways to recovery. Let's pivot to the help that's out there, starting with tobacco. For anyone looking to step away from smoking, you've got a massive range of tools.
This ranges from heavy-hitting clinical prescriptions like varenicline and bupropion, often recommended for severe addictions, all the way to natural herbal aids like St. John's wort, valerian root, and ginseng. Now, a quick, important note from the source material. You should absolutely always consult a well-being practitioner before mixing herbs and medications. But the big takeaway? You don't have to just quit cold turkey. There are medical, natural, and behavioral interventions purpose-built to help you succeed.
When it comes to alcohol and recreational drugs, community support is just massive. Organizations like Alcoholics Anonymous and Narcotics Anonymous offer a highly supportive, totally non-judgmental environment. These meetings are entirely confidential and rooted in the famous 12 guiding steps. That involves admitting powerlessness over the addiction, seeking some form of a higher power, making amends to those you've harmed, and ultimately giving back by helping others. A really key feature here is sponsorship. Experienced members stepping up as mentors to guide newcomers through their recovery journey. It's peers helping peers, and it works.
Sometimes, though, the dependency is severe and formal clinical intervention is necessary. Formal care usually looks like a four-step ladder. It kicks off with detoxification, which provides intense medical supervision to safely manage what can be very dangerous withdrawal symptoms. From there, patients might move to inpatient rehabilitation for 24-hour structured care, completely removed from environmental triggers. Once they stabilize, they step down to outpatient treatment, receiving therapy while adapting to living back at home. And finally, step 4, aftercare. This is the ongoing support plan to maintain sobriety and prevent relapse once the formal treatment wraps up.
Section 5. The Choice Matrix.
Whenever you hit a crossroads with a habit, the source material points out that you basically make one of 4 choices. They call it the choice matrix. Number 1 is to leave. This means walking away from your current habit so your actions align with your values. But hey, leaving isn't always possible right away. So option 2 is to change. You stay in the situation, but you actively leverage your skills and resources to make things better. If you can't leave and you can't change it, option 3 is to tolerate. This is about radical acceptance, acknowledging the reality of the moment and letting painful feelings just pass through without fighting them. Unfortunately, if those first 3 fail, option 4 is to give up. This is where individuals turn to self-defeating behaviors or distracting substances, which usually drops them right back into the cycle of addiction.
So, what will your choice be? We've looked at the biology, we've seen the incredible tech available to track our behaviors, and we've mapped out the real pathways for getting help. The source material is very clear. This isn't about judging the pleasures of these substances, it's about shining a light on the reality of their consequences. How much control do you wield over your situation right now? Will you leave, change, tolerate, or give up? The power to decide is quite literally in your hands. Thank you so much for joining me for this explainer, and I really hope this knowledge empowers whatever choice you make next.